Hello, this is Dr. James Camp at Lee College in Baytown, Texas, and this is my introduction to anatomy and physiology, sometimes called the twin sciences, though as you'll see, they are quite non-identical twins. Okay, I want to zoom in on those first two questions for the rest of this presentation. Uh, First, homeostasis. Uh, Homeostasis is known as the body's active mode most of the time. Most of the time, you're not in a state of crisis. Your body is trying to maintain uh, a stable environment. But sometimes the body's active mode changes because you're facing a demand. You're sick and you're trying to fight off an invading organism, a microorganism, or you're exercising and you need more oxygen and blood to your tissues. Uh, these are not extraordinary changes, um, but they're not homeostasis anymore. We've disrupted homeostasis to respond to a challenge. One of the issues I have with a lot of the textbooks out there is that they say that the entirety of physiology is about maintaining homeostasis. And yet, in fact, some of them even say that disease can be defined as moving away from homeostasis. But would you then say that increasing your heart rate while you exercise is disease? No, of course you wouldn't. So um, clearly, the body really has two different modes in a way. It's got a homeostatic mode and it's got a responsive mode. Homeostasis is going to maintain internal variables. And whenever I say the word variable here, I'm talking about anything you can measure that's capable of changing over time. Your heart rate, your blood sugar, your body temperature, your uh, blood oxygen, any of these things are variables because they vary over time. And homeostasis is going to try to keep those variables within normal limits, okay, to keep the body stable and healthy. But the response mode is going to say, you know what, for a short time, I'm going to set this variable outside its limits to meet a very specific demand. The body needs more oxygen, so I'm going to increase my heart rate. The body needs to fight off an illness, so I'm going to raise my body temperature a little bit. Homeostasis is what defines healthy values for a resting body. We try to get homeostatic values for patients when we do a lab test, for example, because that's the healthy value, at least most of the time. But again, the response mode is capable of altering those values for a short period of time, and that can still be healthy. Okay, a heartbeat of 100 beats per minute is considered tachycardia if you're at rest, but a heartbeat of 120 beats per minute is considered fine if you're running on a treadmill. So a couple of examples here. I've already mentioned these examples, but I want to spell them out. In homeostasis, the heart rate is 70 to 80 beats per minute. 100 would be considered abnormally high. But in response to stress or exercise, the heart rate can easily double that, 140 to 160 beats per minute, and still be considered within the healthy range. In fact, most exercise scientists say that that's what you want for a good cardiovascular workout. When you're in homeostasis, your body temperature is about 37 degrees centigrade, or 98 to 99 degrees Fahrenheit. In response to an infection, however, the body temperature can rise slightly and still be healthy. Most doctors at this point won't consider you to have an unhealthy fever until you're up above 101 degrees, depending on the patient. In homeostasis, blood sugar falls within certain limits. We all know that. We've heard about diabetes as hyperglycemia, too much blood sugar. But did you know that under stress, certain hormones in your body can cause your blood sugar to deliberately rise for a short period of time, or even for a long period of time, to enable your body to withstand that stress? If you're running from a bear in the woods, that kind of stress requires some extra blood sugar. All right, so now for the rest of this presentation, I want to talk about how homeostatic and responsive processes are controlled in the body. It all usually starts with the change in a variable. When a variable changes, this is called a stimulus. For example, blood oxygen falling during exercise or blood sugar rising during a meal. The stimulus is going to be detected by a receptor somewhere. The receptor might be a designated nervous system receptor, like a chemoreceptor embedded in a blood vessel that detects the blood oxygen. Or it might be a specific organ that's programmed to detect that stimulus, like the islets of the pancreas, which detect blood sugar. Then a control center, a second part of this response, decides how to respond. The chemoreceptors in the blood vessels are going to signal to the respiratory center in your brainstem. The islets of the pancreas, on the other hand, are both the receptor and the control center. Sometimes those two functionalities are put together in the same organ. Once the control signal center decides how to respond, it sends a signal to an effector organ. Nerve signals, for example, will go to the breathing muscles to adjust your breathing rate to fix the oxygen problem. The hormone insulin will be sent by the pancreas to a number of target organs to fix the glucose problem, the blood sugar problem. Finally, some sort of response is going to occur, or there wouldn't be any point in doing this. The respiratory rate increases, making more fresh oxygen available, or sugar is removed from the blood and stored in various organs. So if you take out the middle steps, what you can see is that a variable changed, that was the stimulus, and a response occurred. Notice, however, that in both cases, the response fixes the problem that created the stimulus, or at least it addresses the variable change that started with the stimulus. When the response somehow affects, or we say feeds back on the stimulus, we've created a feedback loop. Negative feedback loops are going to reduce or reverse the change that caused the stimulus. If blood oxygen falls, we're going to make more oxygen available and raise the blood oxygen. If blood sugar rises, we're going to store the extra sugar somewhere and reduce the blood sugar. So we're going to return things to normal or restore homeostasis. Most feedback loops work that way. Positive feedback loops are kind of rare. They actually increase the change that caused the stimulus. In other words, they feed back positively. If there was a little change, they feed back to make it a bigger change, and then a bigger change, and then a bigger change. Okay, to put it another way, with a negative feedback loop, if there's an increase, we're going to feed back negatively to decrease it. If there's a decrease, we're going to feed back negatively to increase it. We're always going to push it back to where it started. With a positive feedback loop, there's a little increase, and then a bigger one, and a bigger one, and a bigger one, because we keep feeding back positively on the change. This is all those 6 pieces of a feedback loop that we just talked about in text form. This is those presented in a loop shape, okay, in a loop diagram. Let's look at a negative feedback loop. And since we don't know a lot about the body yet, we're just starting anatomy and physiology, I'm going to take a non-body example. I'm going to talk about what happens when it gets cold outside. Okay, so the stimulus is that your house temperature is going to fall because it got cold outside. Where's the receptor? The receptor is a thermosensor somewhere in your house, usually built into the control center, which is called a thermostat. Usually these two work as a single unit. They're built, in fact, as a single unit. But your thermostat wouldn't be very useful if it didn't have a thermosensor, a thermometer, built in somehow. Okay, so the thermosensor picks up a drop in temperature and informs the thermostat. The thermostat decides, well, we've got to raise the temperature. So it sends a signal called electric power to an effector. What's an effector? An effector is anything that can cause an effect. So that can make an effect happen. Put it a better way, it's anything that can affect the system we're trying to fix. So what can fix what can affect a cold house? A heater, okay? So somewhere in your house you have a heater. Maybe it's a furnace built into your attic that blows cold air, blows hot air into your house. Maybe it's radiators built into various parts of your house that radiate heat that way. Maybe you have a space heater somewhere. However it's designed, you've got something that creates heat. Its response is going to be to warm the air in your house, okay, so that your house temperature increases. Notice that response feeds back on the stimulus. It feeds back in a negative way because the house temperature increasing is the opposite or the negative of the house temperature decreasing. So the response is equal and opposite to the stimulus. That fixes the problem and ends the feedback loop. A few examples of negative feedback in the body. Let's say your body temperature increases. You start to sweat. You dilate your dermal blood vessels. All those things lead to your body temperature decreasing and you return to normal. Let's say your blood sugar increases. Sugar is removed from blood. We just did that example. It's stored in various organs, and so the blood sugar decreases and returns to normal. But it's not always an increase-decrease pattern. It can work the other direction. Let's say blood calcium decreases. Your body needs calcium to function, so calcium is released from your bones, and the blood calcium goes back to normal. Or let's say your blood pressure decreases. If you don't have enough blood pressure, your blood can't flow, so your blood vessels are going to constrict to squeeze on that blood and raise your blood pressure. The blood pressure increases and you return to normal. Notice how all of these examples act to maintain homeostasis. Negative feedback is almost always used to maintain a homeostatic environment, and it's almost always used in homeostatic regulation systems. Now let's look at a positive feedback loop. For this, we do really need to look at the body as an example because I can't come up with any really easy to explain positive feedback loops outside the body. So let's take an example of a woman who is in labor. The stimulus in this case is that the baby starts to enter the birth canal. Okay, so there's a receptor. There are stretch receptors built into the cervix and the vagina that detect the baby moving into the birth canal, and they send a signal to a control center. The control center in this case is the hypothalamus of your brain, which happens to be your body's main nervous system, endocrine system link. Well, the hypothalamus is going to send a signal, and the signal it's going to send is the hormone oxytocin. Some of y'all know its artificial cousin, pitocin, which is used to induce labor. Oxytocin is going to go to an effector organ. Well, what kind of organ can affect a baby entering the birth canal? Well, the uterine muscles can have the effect we're looking for. Now, here we have to ask ourselves, do we want negative feedback? Negative feedback on a baby leaving the womb would be push the baby back in. That's not what we want. We want the baby to be born. So we actually need positive feedback here. We need something that will push the baby further into the birth canal. What would do that? It would be the uterine muscles increasing their rate of contraction. Okay, so we increase our contractions, and that's going to push the baby further out. Well, we started with the baby, okay, it's pushing the baby out of the uterus, so I should say it's going to push the baby further into the birth canal. Okay, so the baby moving into the birth canal is exactly what we started with. And so this effect is positive feedback. So we've now got the baby entering the birth canal even more than it was before. So this arrow gets exaggerated. More stretch receptors are activated, so that arrow gets exaggerated. The hypothalamus is now even more aware of what's going on, so it's going to release more oxytocin. That oxytocin is going to go to the effector, and the effector is going to strengthen its response. So we'll get even more contractions, pushing the baby even further into the birth canal, so we get more positive feedback. Can you see how this system works? Every time you go through the loop, the whole system just gets stronger and bigger, and the whole system gets stronger and the effects get bigger. And this system will continue. It will build up and build up and build up and go on literally forever until something breaks the cycle. Positive feedback loops, unlike negative feedback loops, positive feedback loops need what we might call a stop condition. So at some point, we reach a stop condition. What's the stop condition for giving birth? The baby being out of the body. Okay, so once the baby's out, then there are no more stretch receptors sending signals to the hypothalamus, so the hypothalamus doesn't release any more oxytocin, so the uterine muscles will slowly wind down their contractions, and the labor will come to an end. Some more examples of positive feedback, most of which seem to involve the reproductive system. When a baby suckles at its mother's breast, the breast is stimulated to eject, we say, or let down in common language, milk from its glands into the nipple where the baby can get it. As a result, the baby suckles more. Okay, there's milk here, let me get it. That's going to stimulate more milk to be let down, and this process continues until we reach a stop condition. The baby stops nursing, or the mother runs out of milk. When platelets stick to a broken blood vessel wall, okay, your blood vessel is broken, you're bleeding, you need it to stop, right? The platelets stick to the broken blood vessel wall. They release factors that attract more platelets. So more platelets stick. They release more factors that recruit more platelets. So more platelets stick. So more factors. So more platelets. So more factors. So more platelets. And that process continues until we've completely covered the wound and we have what's called a platelet plug. Then other factors will start that form a fibrin mesh, and that's also a positive feedback process. So the entire process of what we call hemostasis, stopping the bleeding, is built around positive feedback. Why? Because we want to speed up, we want that to happen as quickly as possible. Finally, a little more complicated example, one we'll get to at the very end of this class. When the female reproductive system wants to ovulate, a hormone called follicle-stimulating hormone causes the ovarian follicle to grow. The growing follicle releases more of a hormone called estrogen. Estrogen has this effect of causing more FSH to be released. Well, FSH causes the follicle to grow even more, and the process continues over and over and over again. Note that these examples are largely not about homeostasis. They're about accomplishing some sort of a task. Feeding an infant, stopping the bleeding, preparing for ovulation. We're trying to do something and get it done quickly, usually. Okay, that's the end. You now know the basic approaches that anatomy and physiology take to studying the body, and you know how, with the form follows function motif, we're going to try to integrate those two into the study of both in my class. And you know a little bit about negative and positive feedback. Stay tuned. We'll talk about feedback loops throughout the rest of this class. Thank you for your attention. Good night.